Hi, Ariana. What are you here for at Cosmetic Healthcare Group today?
So I'm here to get lip injections because I feel like my upper lip is a bit smaller than my bottom lip. So I want to even them out and I want to add a little plumpness to them.
Have you ever had injections before?
No, this is my first time.
So Caitlin, our MA, is applying topical anesthetic to our patient Ariana. Caitlin, what does this do?
This will numb the area so the injections will be more comfortable for her.
And what type of injection does Dr. Madnani use for lip
Today
injections?
he's using Restalyne. Every patient is different, but for her he's going to use Restalyne in the lips.
Okay, great. So how long is it going to take for the topical to work, for this anesthetic to
She'll
work?
start feeling tingly in like 5 minutes, but it's completely more or less numb in like 10 to 15, 20 minutes.
On Ariana, we're looking at doing lip filler. So chin up for me, Ariana, and open your mouth just a touch. Her concern is that she doesn't have enough volume in the upper lip there, and what I like to do is fill in the middle third of the lip. So I'm going to concentrate in here and here, and then I'll add a little bit more to the sides of the lip. So you'll see once we volumize the middle third of the lip here, things will just look so much better. Her lips are a little full now. They appear a little fuller because she's had the topical numbing on there for a little bit. But we have pictures. She's numb with topical numbing for about 20 minutes, and we're going to go ahead and do the filler right now. My favorite filler for lips is Restalyne. It's a hyaluronic acid sugar gel. It has lidocaine mixed in it, and I like the. It comes with a very tiny needle, and you'll see with the. That's how the product comes. It's a syringe with about 1 ml of product in there, and it already has the lidocaine, which is the numbing medication, already mixed in there. So, before our patients come in for any fillers or injectables, we routinely tell them over the phone to avoid any blood thinning or blood thinner type of products, such as aspirin, Motrin, Advil, Aleve, ibuprofen, even vitamins or supplements like fish oil or omega-3s, because they just tend to thin your blood. So my aim is to do an injection with minimal swelling or bruising, so you can go about your day right afterwards. So this is just the sticker that we keep track of what we've used. That goes in our chart over here. And we have tiny, tiny little needle. It's a 29 gauge. And they've made it red, same color as lips, how appropriate. And we are going to go ahead and, you ready?
I'm ready.
All right, this is Ariana's first time with lip filler, so here goes. Great, why don't you put your hand back for me? And I'm going to give her a distractor. This is a great little tool. Just makes the whole process more comfortable for her.
Thank
you. You're welcome. Just a couple little sticks, okay, Rita?
Mm-hmm.
So, chin up for me. So since this has numbing medication in it, I'm going to place the product a little bit first and then let it sit for a bit, and then I go back in with some more. Open your mouth just a touch for me. Great. Pinch. We're able to mix the product in a little bit here. Great, we use a very small amount. You okay?
Mm-hmm.
Not too bad, right?
No.
All right, here we go. I'm just going to keep going. Great, so we can see this side is already nice and full. They look gorgeous.
That's great.
Let me get it over there, okay? And I'll do the same thing on the other side. I'm keeping track of how much I'm putting in there. So these results are obviously immediate. Beautiful. So we can see how nice. You want to see quickly?
Yeah.
You can take a look, okay? So before I massage the lips in a little bit, she's already able to see how nice and much fuller.
Oh yeah, they're so much fuller.
Okay, head back for me. Great. So, what I like to do is make the most of the features that she has. So what Ariana has is a gorgeous shaped, she got a gorgeous shape to the rim of the lips. So I'm not gonna do anything there. But what's also interesting is that she has the same shape to the lower lip down here. I don't wanna lose that because I think for her lips are very unique that way. They just don't look like one big pillow. She has a nice shape to it. So we've had a conversation about, do we get rid of that shape? Do we not get rid of that shape? For me, I like to maintain the unique features of people's faces. In her situation, she's obviously very pretty. We just want to add a little fullness. So I'm going to just keep the fullness there. I'm pretty happy with the way it looks now. So what I'm going to do is add a little bit to the lower lip, and then we'll go back to the upper lip. How does that sound?
Awesome.
We've come up with a plan. Head back for me. I do also want to fill out now more on the sides here, because she can definitely tolerate it. So we're going to go ahead and do that. I'm entering where she's already numb. And when we're done, we'll massage the lips a little bit. So you can see there's no bruising. We'll also have her ice afterwards just to be. Pretty numb, right?
Yeah.
That hurt at all?
No, not at all.
Smile for me. Great. So her lips are swollen, and this is gonna go down in about an hour or so. And we're gonna give her an ice pack. So take a quick look, and then you can ice it.
Awesome.
Dr. Madnani, how long does the filler last for?
That should last her close to 6 months. 4 to 6 months. Nice.
It looks so good.
Pucker and smile, big. Great. So everything looks nice and even and natural there, and she's just gonna ice it. It should last her about 4 to 6 months with the filler. So what I normally do is I have my patients come back after 2 weeks, and we can do touch-ups at that time. We can add more filler at that time. Sometimes if a patient comes in with some volume loss and they just want a little bit of filler, we can add a little bit, and then when they come back in 2 weeks, we can do a touch-up at that time as well. So yeah, we're very excited. She was great. Okay.
Thank you.
So our precautions for afterwards is no gym for 24 hours. She's going to be numb for about an hour or so. So just be careful what she eats and drinks for the next hour, or nothing too hot. She can bite her lip if she's not paying attention. And I'll see her back in 2 weeks for a recheck.
Ariana is done getting her lip injections. How did it feel, and what are your thoughts? Because I know you said this was your first time.
Yeah, so I was a little nervous because I've heard that some people pass out and that it's very painful, but honestly I didn't feel anything. I think the topical numbing cream really helped. It was completely painless, and I love how they look.
That's so great. I mean, your lips look amazing. From here, you can see a difference already. So, yeah. So I've heard people pass out as well, and I've heard that the lips are the most painful. So you really didn't feel anything at all.
I didn't feel anything. It was 100% painless.
So you'd get it again in 6 months?
Definitely.
Yeah.
Definitely.
Oh my gosh. Well, awesome. Have a great rest of the day and enjoy those lips.